Okay, so I'm going to be showing how to spike and prime your tubing. So first I'm going to walk into my patient's room and make sure I have the right patient, the right solution and everything. I'm gonna check my solution, make sure the dates aren't expired and all that good stuff. I'm going to label my bag with the patient's name, the rate, the date, and my initials. And then we're gonna just jump right in. Normally this stuff would be in separate bags. All this type of stuff is sterile because it's going into your patient. So we're gonna make sure that all this stuff is sterile. Normally with this, there would be a little, like this would be on it to keep it from being sterile, but we obviously practice. So we tore that off already. We got that open. We're gonna open up our tubing. All of our tubing has little tabs on it, but before we do any of that, I'm going to do hand hygiene. Make sure this doesn't fall. Hand hygiene and put on my gloves before touching any of the opened supplies. I use these gloves. Okay. So we're about to spike our tubing. It's pretty simple. We have this open. You're gonna take your spike. And then you're just gonna turn this upside down and stab it in. Sometimes you have to like twist it in. You wanna make sure that it's pretty stable. And then when I have that, we're gonna flip it over and hang our tubing. We always wanna make sure that our tubing is held higher than our patient, obviously. And then we're going to fill the drip. So you can do this by squeezing it a little bit. You're gonna fill it about 1/3 to about half. Okay, good enough. And then after this, to prime your tubing, priming your tubing is used so there's no air in our tubing and we don't push air through our patients. So by doing this, and during that whole thing, we're gonna make sure that our clamps close so we don't have just water flipping out everywhere. But when we do this, we wanna make sure that we have a place to pour the water. We're gonna let the tubing fill up with water, get all the air bubbles out. Once we've made sure that there's no air bubbles, we can close that again and continue hooking up our medication. And after that, we're just gonna make sure that our patient's okay and all that good stuff.